Okay, tonight's presenter is Carol Wells, and Carol's one of the hygienists in Canada A that is with our group. And tonight she is going to educate us on a topic that we're all interested in. So Carol, take it away.
Good evening, everybody. What I'm going to be talking about is co-discovery, and another word is for naturally speaking, what the patient actually hears when they're in the dental chair. So I just wanted to recognize that the groups that I have been privileged to learn from is Dr. Bob Barkley or Dr. Robert Barkley, the group of Cox, ProSynergy, which is Doug and Sandy Roth, Bud Ham, Avron King, Doug Young. I was privileged to be able to go to many of their different lectures. So this is a combination of their information. So the first thing we want to start off is preventive dentistry. And preventive dentistry is a branch of dentistry that deals with the preservation of healthy teeth and gums and the prevention of dental caries and oral disease. So really dentistry is in uncharted waters right now in the 21st century because people are just keeping their teeth a lot longer. So we've gone from an office that has drill and fill to a self-care practice, a comprehensive dental care practice, which focuses on prevention. We want to be proactive instead of reactive in helping our patients to become healthier. And we want to be the leaders in dentistry as we want to inspire team members and our patients to want to become healthier. So the Pankey Institute was developed by Dr. Pankey, a dentist in Coral Gables in 1926. He actually wasn't the dentist then, and he decided that he wanted to practice dentistry without pulling another tooth. So he created the Pankey Institute. In 1965, a dentist named Dr. Robert Barkley decided to go to a 3-day course there, and that's where they discovered the preventive dentistry. So right now, dentistry provides an excellent opportunity for creating a new model of healthcare because it's discretionary in the absence of swelling or bleeding or pain, which permits individual choices, psychological ownership with the respect to personal health planning. Dental disease is preventable, where the individual participants actively go through a self-care process. Dentistry is organized, which leads to the possibility of widespread applications on these principles. It helps to relate to disease, which helps people learn from their own role in the living of their own lives. It's team-based. It's leading into the ample time for unhurried communication and appropriate health counseling. Because we have a universal risk of periodontal disease, we're able to build a long-term relationship between the providers and the people that we serve. And we're able to become more effective as the people providing the care move from staff to team members. So the dental team, and this is from Dr. Barkley's foundation, we further believe in freedom of choice for healthcare for participants and providers. We respect relationships which are non-judgmental and non-manipulative. We value a transformation model of healthcare which is characterized by learning, growth, and development for all team members, team building founded on shared vision and values, effective communications of healthcare options and choices, counseling of patients who choose to create their own health plan. So the focus is on self-care in the prevention of dental disease. We're able to offer excellent therapies and treatment, appropriate environmental systems and technologies, and continue in the relationship between healthcare providers and consumers, all of which is founded on the respect for the concepts and perceptions of those being served by the dental team. We want to offer respect for creating experiences and opportunities which dignify participants. So Dr. Robert Barkley wrote a comment, and his comment was, "Dental health is peculiar. The rich cannot buy it and the poor cannot have it given to them. I can make people more comfortable, more functional, and more attractive, but I cannot make them healthy. I can teach them how to become healthy, but whether they remain that way will be up to them." We now know that the true sustainable health can only come about through a growth of a person's sense of responsibility to themselves. So co-discovery, they broke it down into 3 different phases. They've got the relationship development phase, which goes through preclinical interviews and an ongoing peer-to-peer discussions through established interdependent relationships with each person. Learning together through facilitated co-discovery dialogue, values clarification, and the establishment of the related to what is learned. Goal setting through envisioning, collaboration, planning, negotiation, and commitment. Simply put, when a patient needs to make a decision regarding deeply personal and complex problems, they also need proper leadership in order to help them make those choices. And that, in a nutshell, is the purpose behind Bob Barkley's 3-phase adult education to support better healthcare-centered decisions. So co-discovery, it's a technique that we learn from each other. So a facilitator takes the first phone call from the patient. I was fortunate to work in an office where we had facilitators. We had 2 facilitators working with our patients. So they would take the phone call as each new patient called. And this is the time to discuss concerns of the patient. All the primary concerns: is it an emergency visit? When was the last time you visit your dentist or dental hygienist? And review the initial appointment and what records are required. And normally there was no treatment performed we discussed how no treatment was performed at the initial visit unless they indicated that it was an emergency visit. At that time, fees and payment methods were discussed. And then when the patient was ready, the appointment was booked in the dentist chair as well as the facilitator was booked in with that appointment as well. So when the patient arrives for the first appointment, the facilitator, let's call her Mary, takes the patient back into a private area. Now, Mary can fill out the necessary paperwork instead of handing a clipboard to the patient when they come in for them to sit in the reception area and fill out on their own. It's something that we felt that the facilitator was better to be able to sit one-on-one with the patient. So things were filled out like the medical history. You could have discussions about the previous dental visits to determine any special requirements that were necessary to help the patient become comfortable. Mary would like to find out about the previous dental and medical history. So what we want to look at is the past history of the patient. Where are they coming from? We want to find out where the patient is now. What's going on in their mouth? What are their concerns? And then we would like to know where would they like to go with their dental health? Where do they see their future coming? Do they see it enabled to be able to keep their teeth for a lifetime? Is that something that they're interested in? So we want to know what their future plans are. So then once all the necessary forms have been filled out, the patient, along with Mary, enters the operatory. Then the assistant can take any of the necessary records, your x-rays, your TC scan, any of those necessary records. And then ideally, a dental hygienist is involved to complete the periodontal assessment. So once the dentist arrives into the operatory, the introductions are made and Mary gets to view the hopes, the wishes, and the goals for the patient in a discussion with the dentist. So then the clinical notes are taken, intraoral photos are taken. Intraoral photos are a very important part of a new patient's experience because they now get to see everything that we get to see. We get to show them where the tooth is broken, where the tooth is cracked, any fillings that have changed, anything that's going on. They don't have to take our word for it any longer. They get to be able to see it in real time. So then the dentist reviews the findings with the patient using the intraoral camera, and then they get to review any questions and concerns the patient has. And then once all of this is complete, Mary and the patient leaves the operatory to go back into a private office to continue the discussions there. We want to separate it from going into an operatory and taking it out of the operatory so that it makes it an impact of the patient and it offers a better service for the patient. So then Mary is the one to review the dental treatment based on what the needs and wants and desires of the patient. So we get to discuss the treatment options, which area require immediate attention, helps the patient prioritize which direction they'd like to pursue first. Then they go into a treatment plan, which is organized. And then again, if the patient doesn't want to do anything, that is an option. They can choose. They don't need to do anything. They get to choose what they would like to do. And at this time, fees and payment methods are discussed and finalized. And this is a good time if you're moving to an insurance-based practice. We would not accept insurance forms. We would talk to our patients about how the insurance is a relationship that they have with their insurer, and that we take a payment directly from the patient, not from the insurance company. So then at that time, the patient has an opportunity to ask any of the questions that they want. At that time, the patient feels heard. And when the patient is ready, then the facilitator is able to book the appointments as the patient wants to proceed. So an interdependent relationship is patients cannot achieve dental health on their own, and we as clinicians cannot fix the patient. This relationship has to become interdependent. The patient and the dental team work together to help the patient achieve the goals to become healthy. Sandy Roth from ProSynergy, it was a dental communication organization that our office worked with for quite a while, and this is one of her statements. The client must want to be healthy, and health is a sense that can only be the result of a personal sense of responsibility. Some of us learned very long time ago at school that we were able to make people healthy through a series of technical and clinical procedures. Our job was to fix, to correct, to repair, to remediate. We learned that we are the healers of others, and that we were to teach those who came to us, and that they would make them good patients. Fixing really doesn't fix. Teaching doesn't cause learning. We continue the same behaviors and the patients continue theirs. Wouldn't it be refreshing to find ways to engage your client without feeling like you're constantly scolding them? Now, I take it that in Canada, we can use the word client, but I understand in the States you have to use the word patient. So sorry when I go back and forth between the two. So now we go into a hygiene-driven practice. And this is a point where when you become a certified biological dental hygienist, you get to take it 12 steps further, where you get to, your knowledge base is much larger. You get to look at everything comprehensively for the patient. So first of all, do our patients know that they can keep their teeth for a lifetime? I mean, how many true discussions that we have when we're crammed into a 60-minute recall visit? After all, we have a lot of things to get accomplished. We have to look at the medical history, changes since the last visit, update any x-rays that are necessary. We have time for the dental x-ray or the doctor to do his exam or her. We use the pre-rinsing, we're taking the vitals, the head and neck cancer screening, family history. So in that time, we have allowed the patients to think that our appointment is about cleaning the teeth when it's really about health and how do we help them to become healthier. So we actually do a lot of telling in dentistry. We tell them where the plaque is. We tell them what the plaque does to the gums and the supporting bone. We tell them about the inflammation and infection. We tell them where the food is. We tell them where their gums are bleeding. We tell them they need to brush better, longer. We tell them they have to floss. But what we're telling them, what are they hearing? So telling is not learning. We know that dental disease is multifactorial. We have an acronym that we can use to help the patient understand the many factors, including oral health. That acronym is HONEST AGE. So we have hygiene, occlusion, nutrition, exercise, stress, tobacco, alcohol, age, genetics, environment, and past experience. All these things we have is a discussion that we have with the client to find out what they're doing with their home care. All of these things we would take a look at, and it's multifactorial, so we would actually look at all the factors involved at where their health is at the time that you're seeing them. So when we stay curious about a patient's home care, we can help them to want to help themselves, to help them become more effective with the tools they have. We want to help them find better ones that work for them, so we get them to show us what they're working with, what's working for them, what isn't working for them. It's good to use disclosing solution. We have the type that you can paint on, and I would recommend painting it on with a Q-tip just in certain areas. so that the patient is able to learn how to remove it. All the patients have their teeth or clean their teeth before they come into a dental appointment, but we know as practitioners that there's always a lot of plaque present on their teeth. So the two-tone really helps them to understand what's 24 hours old and what's 48 hours old. So it's a very good learning tool to have. So what do our patients really hear or understand when we're talking about all of these different things? We're not hairdressers. We don't need to chat about the weather, nor do we need to talk about anything about the treatment plan that we're doing. We want to stay focused on what we want to accomplish with them. We, of course, want to talk about a few things we want to go through with their family, but we don't want to be a car wash service so that everybody gets the same service. So there's a syndrome, I call it the yes syndrome. It's when the chair goes back, the patient just wants to agree to anything that we are saying so that they can get their teeth cleaned and get up and out of the chair. It's something that is quite profound when you get somebody who's nervous. They really can't hear anything. So if you have the chair sitting up and you have eye-to-eye contact, you have a lot more contact with the person. It makes them more at ease. It just helps the appointment move much smoother. So now the patient they think as long as they're coming in for regular appointments, that this is all they need to do to have a healthy mouth. Have we misled our patients into believing that as long as they show up for their appointments and they have us do our stuff to them, is our cleaning their teeth enough to make them healthy? We know that that's not the case, but we've done a really good job of teaching our patients to come in at intervals. What if we allowed them or taught them how to have clean teeth 365 days out of the year? Then they don't need our services. So there's things that we can use to help move them in a different direction, help them move towards health. We've got the phase contrast microscope. It's a wonderful diagnostic tool that helps the patient connect to the infection and the disease present in their mouth. What you do is you collect some subgingival plaque and you put it on a slide and you're able to view it in the microscope, and then you also have a monitor which the patient can see. So the patient actually gets to see their own plaque sample, and when they see that, they start to ask what they can do differently to get rid of that stuff. Now they can see why they need to take better care of their teeth, what their home care is so important, and what they're trying to achieve. So you've got things like I said, the disclosing solution, and also you've got the intraoral camera. So you'll have that at your disposal because all of those pictures were taken at the initial appointment. You can also use it to take pictures of how much plaque is on their teeth, how much calculus is on their teeth, what their fillings look like, what changes have occurred. It's something that you can follow along in. Just more tools in your toolbox to work with. So what we want to do is we want to be the catalyst that empowers our clients to seek self-improvement. Then our satisfaction will be derived from filling our patients' needs while staying true to our college directives and standard of care and our own passion for making a difference in the lives we touch. Instead of becoming dental hygienists, teeth cleaners, we can become dental co-therapists or biological dental hygienists. So then we move into the program of self-care for our children and for our adults as well, but this section is based on developing a self-care for children. So teaching children how to clean their own teeth. So we would have a room set up specifically for children without a dental chair in the room. And what you would need in the room would be mirrors and sink, you know, all the large puppets that we have, the large toothbrushes, so the children can learn through play how to work with their own teeth, how many teeth they have, what areas are difficult to reach, and parents are invited to be in the room as well. We found that we would keep the children in the self-care practice area until they were about 10 years old, and they would move into the hygiene department. So at that time, you would use the puppets, let the children experience through play with the puppets, and then you would also use the microscope for them so that they were able to see where the sugar bugs are. As well, using the two-tone solution, a disclosing solution, so that they could see the plaque on their teeth, or what we call sugar bugs when we're dealing with the children. And then we go into what's called a self-prophy. What we want to do is use the disclosing solution on their teeth and allow the children to brush their teeth. This way they can learn how to hold the toothbrush. You can coach them through that. It helps them to develop their own their dexterity and accessing the hard to reach area. And then mom and dad are involved in those appointments to learn which areas need more time brushing. And we instruct the parents to allow their children to brush their teeth once or twice a day on their own, but the parents should be brushing their teeth in the morning and in the evening. We usually have child life specialists working with our children in the self-care program. They're behaviorally set up to learn child development. So we found that child life specialist works very well in our offices. So then when the child is ready, once the teeth are all clean, and if there's any leftover plaque, then the child life specialist or the dental assistant or hygienist is able to move it with a toothbrush. We didn't prophy any children's teeth unless they had stains on them. And then we would have the dental hygienist go in and remove the stains. So the only time that the child actually sits in the dental chair is when the dentist is ready to look at their teeth, or the dental hygienist for the preliminary exam, or for the x-rays that are necessary, when they are necessary. So then when we have the children that are needing treatment, we actually have the child life specialist set up an appointment with the child. So they would take them into the operatory and they would sit there and help them with the air water syringe, the noises of the drill, all the sounds of the suctions. And then when we are ready to book the treatment, the child life specialist is booked in with the children. So we would start off with a half an hour with the child life specialist in reviewing all the techniques and the sounds and the noises that the child is going to hear. And then the child life specialist is actually booked in with the dentist and the child for their dentistry. And the benefits of the self-care program is just to allow the children to become more effective with their home care. They become engaged with what they're learning, and now they know what they have to remove off their teeth. They become healthy adults. We've had a program, I had a neighbor actually that came to me, and her daughter was sent to a specialist to be able to have a filling. She had a lot of cavities. She needed some fillings taken care of. And my neighbor was in tears because her daughter was screaming as the dentist was filling their teeth. And the mother tried to get the dentist to stop, and the dentist just looked at her and says, well, what do you want me to do? She has holes in her teeth. We need to finish. So this little girl obviously was terrified to go to another dentist again. And I encouraged her to come to the dental office that I worked in. And the first time she came in, she had these big, huge crocodile tears just falling down her face. And, you know, I assured her I wasn't seeing her clinically, but the child life specialist was in the self-care program. And I just encouraged her to give Mary a chance to be able to take a look and see how it is. And fast forward about a year later, she would come in, the child would come skipping into the office, bright, cheery, not fearful at all. So we encouraged them to be able to work through any of the problems that they had so that they had a good, healthy dental experience. We found that if any of the children were crying during dentistry, that we had to stop the treatment and be able to support the patient, to support the child through that. And if it became necessary, then we would have either IV sedation or the complete sedation. We would bring in a anesthesiologist that would be able to take care of the appointment for the child, so that it made them be able to not be fearful. We honored the principle of do no harm. So we wanted to make sure that we were able to help these children move to a different place. And that's it. I went through things very fast. Dawn, are you there?
Hi, Carol.
Hi.
Hi, this is Svetlana.
Hello, how are you?
I have a question. I don't know, maybe Don stepped out, but I put it on the chat. Is it possible to get a script of your lecture? Because you have such an eloquent language, especially in the beginning when you're explaining the purpose of the patient being there and, you know, just the whole purpose of the preventative dentistry. And I wasn't fast enough writing your words.
I see.
Is it possible to share your script with me or everybody?
Yes, I can share the PowerPoint. For some reason, I was unable to put my PowerPoint up on the screen this evening. So
Okay.
what we can do is, if we can get your email address, I can definitely send you my presentation.
Yeah, I would love to. I'm putting my address on the chat.
Okay.
Can you see that? Are you able to see the chat?
Just opening up.
I'm here. I couldn't get it to unmute.
Oh, okay. Hi, Don.
Clicking and clicking. So maybe there, is an awful lot of people on Zoom. Okay, what were the questions on here? It says, is it possible to, is it possible to get a script of the lectures beautifully put together? And I'm not fast enough writing Carol's words. I think Carol does have a PowerPoint of it.
Yes, she just said that she's gonna email it to us.
Yes.
So I put my email, and I also wanted, I don't know, can Carol still hear me?
Oh, yes, I can.
Oh, okay. I also wanted to see if you have your health and dental history form, because I am in the process of updating mine, and I want to ask so many questions, but I want to boil it down to what other people do. So if you can share your history forms, I would love that too.
I am not working clinically any longer, and I haven't worked clinically for about 13 years. So my forms would not be up to date, but I'm sure somebody else can help you. Maybe Dr. Scott is able to help you with that.
Yeah, I have hers. I have Teresa's.
Oh, okay. Okay.
Yeah. I'm just trying to kind of boil it down to the most essential questions that I need to ask, because otherwise we'll be talking for like 3 hours. Everybody has like stuff to talk about.
Right.
Yeah, does anybody have any questions or ideas? I don't know how appropriate it is to say here, but I heard what you were saying in the beginning about how we tell them things and maybe what they hear is different.
Mm-hmm.
And so I always use the example that, I got into EMS and I was still dabbling in dentistry, kind of working at my sister-in-law's office, trying to help her grow her practice. And so I would bring some of the firemen in. Firemen are not very good about taking care of their teeth. I'm not really sure why. And EMS people the same way. And so I would drag them in there. And the one person I took in was my partner. And I was constantly ragging at him about he needed to brush his teeth before we would go to bed at night. I mean, this is a guy who's married, and here I am parenting him, and how important it was to floss. And so I get him in the chair, and the first thing he says is, "Forgive me, hygienist, for I have sinned. I've not been flossing my teeth every day." And I said, "No shit. I mean, I'm the one that sleeps with you every third night." Working on a 24-hour shift, I know what's going on. But it took being very visual. So like you said, the microscope for some people, just seeing that it's real bacteria that's there. They don't have the the concept that it's not supposed to be there, and that it's not normal for your gums to bleed. And he just had no, I mean, sometimes you'd talk to him and you'd see blood on his lip from his gums. It just drove me crazy. So I like the idea of a microscope, personally.
And if people would find a value, I can put together a microscope lecture as well, where I have a video where I can show them what to look for and what things would be present in some people's mouths.
Yeah, I think that would be a really good one for us to, even if we do it as an extra Zoom and throw it up on, if you do it and you're having trouble with the PowerPoint, if you just send it directly to Lisa, then Lisa can, because I've done that on a couple of things where I've just sent things to Lisa and said, hey, throw it up there in our, you know, on our website.
Right.
So that would be a good resource. I'm curious how many people are out there. How many people stain their patients? No? Teresa, you don't stain patients in your office? Your hygienists don't?
Stain them as in do plaque disclosing or stain the
Yes.
slides?
No.
Oh, we do plaque disclosing on everybody. I thought you were talking about staining slides. I'm like, no.
No. I'm talking about disclosing the patient. And
No, we do that on virtually everybody. We do that two-tone stuff,
yes,
which is nice because if it's less than 24 hours old, it turns it pink. And if it's more than 24 hours old, it turns the plaque purple.
blue, yeah.
So, you know, it's very nice for that reason.
Yeah, I don't know. I guess until it's pointed out to you, because even with my son, I'd say you couldn't have possibly brushed your teeth because I'm standing 4 feet away from you and I can see stuff on your teeth. So I don't know what it is about people that they can't feel with their tongue that their teeth aren't slick, but it is amazing how those of us that think about teeth all the time, and I mean, gosh, there's the guy at Lowe's, I can barely look at him either. He's a really nice guy, but he just doesn't care about what's on his teeth.
Well, I think
So
the word really is effective. We know that everybody wants to brush their teeth, and everybody does brush their teeth, especially if they're coming in to see the dentist. But the problem is that they're not effective. And that's what the disclosing solution allows them to do. It allows them to learn how to be effective. And then you can teach them how to feel with their tongue, get them to feel their teeth before they've brushed, and then coach them each time they come in and see what it feels like when they have clean teeth. And the kids get it really easily. You know, you call them little fuzzy jackets and the kids know how to feel the difference there. So it's part of the education that we need to do, and telling them to do it isn't helping them. We have to show them, we have to work with them until they become effective at their home care.
Yeah, I think the struggle is when you're dealing with an adult. You know, I remember Ziam telling me, Ziam works in David Francis's office, and she's from Vietnam. And she said, you know, in Vietnam, there was no home care education. And so it wasn't until she came here to the United States that she really even learned anything about taking care of your mouth. And so it either becomes like what you said, where you're the witch that nobody wants to come see because they're going to get ragged at every single time they come, or you find a way to become more helpful.
Right.
Oh, no, I'm not so good at that. I'm better at being the witch.
Well, I was fortunate to have lots of training with all of those exciting people that I mentioned at the beginning. So it was a journey, and it takes a long time to be able to get to a place where you can be a patient-centered practice. And it's wonderful once you get there, because when everybody's got the discretionary dollars, we never had a problem filling our dental chairs because everybody had value to their appointment. And that's what we want. We want value to the appointment. We want patients to be able to understand why they're there and what they're doing. And when you can follow it up with the internal camera, then it just closes the deal for them. I believe Sandy Roth at one time wrote a book as well, and it was called Death of a False Hope, meaning that nobody comes into the dental office and is hopeful that they have something wrong with their mouth. Everybody believes that their mouth is good because it doesn't hurt them. So for some people, it's really discouraging for them to find out exactly what's going on. And even when people go to other dental offices and have a full mouth reconstruction, and unfortunately the dentistry was terrible, and to deliver those kind of messages are very, very difficult. But if you have the pictures to back it up, you can show them.
Yeah, I mean, why does people spend so much money getting a pedicure to get their toe jam taken out from under their nails? And nobody, you know, the person taking care of them is usually can't even speak their language, but they don't tell them, oh, how disgusting, you have toe jam under your nails. It's as if we need to find a way for dentistry to present itself like a spa, where people want to come in and feel how wonderful their mouth feels when their gums are not bleeding and they're nice and slick versus being fuzzy.
Well, part of the problem is that there's no pain involved unless it's too late. I mean, with people with their gums bleeding, they're not concerned about it. How is that possible? I mean, if you were brushing your hair and your scalp started bleeding, or you're washing your hands and they started bleeding, that would be very, everybody would be alarmed if that happened. But for some reason, when it happens in their mouth, they can ignore it. And we call that blood in the sink. If you see blood in the sink, then you've got a problem. You need to deal with it. And even when I was helping patients become healthier and doing all the treatments that they needed to follow up with their home care, and using the Sonic Care toothbrush was much more expensive than just going out and buying a regular toothbrush, even an electric toothbrush. And they're like, well, it costs too much. And it's like, okay, well, how often do you go to the hairdressers? How much do you spend when you go to the hairdressers every 6 weeks? And you have to help them understand their priorities, the way they are, and what they're paying for. And then when you can put it in perspective like that, it just helps move them along quicker.
I agree. Well, does anybody else have any questions? Anything for Carol? No?
I've got 2 email addresses here that would like the PowerPoint presentation, so I can send that to them.
Okay, awesome. And I'm sorry we had a glitch with that. I think maybe I'll have to be better about getting, making sure that all the speakers know how to get up on Zoom, provided we do have a couple safety features on the Zoom, so hopefully we won't get Zoom bombed, whatever that is. Because I did put those in place, so you guys could feel better about being on the Zoom meetings. But we'll have one tomorrow night, the same bat time, same bat place. So hopefully you guys will attend. And thank you so much. Thank you, Carol.
Thank you.